Let the dog in.
All right, so what are you doing in today? What's going on?
My knee feels really bad. My left knee, it hurts.
So what happened?
So I was playing soccer, dribbling down the field. I felt all my weight on my left knee on turf.
Okay, have you ever had any injury to your left knee before?
Nope.
No. Any popping, cracking, snapping sounds when you fell?
Nope.
No. Any numbness, tingling down your leg, up your leg, anything like that?
It just feels really stiff if I try to bend it or straighten it all the way. It's really stiff.
Okay, so I'm just gonna palpate your patella. Actually, I'm gonna look and compare bilaterally. Have you noticed any swelling or discoloration
Yes,
to your left
it's kind of swollen.
It's kind of swollen?
Yeah.
Okay, so upon palpation, the patient's knee has like a watery consistency prepared bilaterally. Yeah, and then I'm just gonna do a couple, like just range of motion, and I just want you to relax your left knee. Just relax, and I'm gonna flex your knee. Extend your knee and flex your knee. Does that hurt?
Not really.
Not really. Flex and extend.
If I push on my knee, it hurts a lot.
And then you go ahead and extend your knee and flex your knee. Painful?
No, it just feels really stiff and tight.
Okay. And then I'm just gonna do some tap tests just to see.
Oh, that kind of hurts a little bit.
Okay. Yeah.
Ow.
And then right now, if I had a tuning fork, I'd use a tuning fork to see if there were any fracture to the area, and that's kind of what tap test does too. But I don't have a tuning fork, so we'll pretend I do a tuning fork and I do it around the patella. I'm looking for any fracture, anything like that within the area. I'm also going to look for a possible PCL tear. So what I want you to do is just lay on your back and put your knees up like this. Good. And I'm going to use anterior drawer because you can get, no, you're fine. You're fine.
Okay.
Go away, dog. And I'm just, scoot back just a little. I'm just going to do anterior drawer. Just relax, relax. Because you can also get tests. No, it shouldn't hurt. It shouldn't hurt.
When your thumb presses on it, it hurts.
Yeah. So no sign of a PCL tear. So that's good. Go ahead and sit back up again. And then have you noticed any like temperature difference? Like is your left knee hotter than your right? Anything like that?
No.
Any discoloration?
Not really.
No. Any pain when you're walking? Anything like that?
No, just if I bend it or squat
You bend
down.
it or squat? Okay.
Yeah.
So does it feel like watery, like it's like really tight?
Yes.
Okay.
It feels very tight.
Okay, so I think I'm gonna call it bursitis. She fell directly onto her knee, so probably inflamed the bursitis or popped her bursitis. But since the swelling is really mild, we're just gonna call it like low grade bursitis. A secondary would be possible PCL tear, but since we did test for that and it wasn't there, we're gonna call it good. So treatment would be to do effleurage massage, try and get the fluid out of there, get her legs elevated to push that fluid out, get range of motion back without pain, and then that's pretty much it. Thank you.
I have